Stellenbosch University has a special program on healthcare in rural areas, and some with those special skills are attending a two-day conference. Tending to mothers and newborns is one of the focus areas, with mobile clinics earmarked as a valuable aid. This weekend's event, in partnership with Gift of the Givers, highlights the gains and the challenges of workers in disaster zones. Our reporter Erin Bates is there for another update. Erin, good to have you on. Firstly, what are the South African teams shared about their experiences there?
Well, one of the things that has come through very clearly is that failing to plan is planning to fail. And there's an incredible amount of coordination that happens in the background. And then, of course, boots hit the ground, whether it's locally after a flood or a fire, or internationally after a war, a hurricane, or an earthquake. And in those circumstances, the work of rescue teams, search and rescue teams, can be incredibly important. Marcus Butler is a rescue coordinator. He's worked with Gift of the Givers for decades. And Marcus, you were telling me, if you're not careful, going to a disaster area, it's a bit like walking into someone's kitchen while they're out of the house and starting to cook. You've got to handle those relationships really carefully. How do you do that?
Yeah, Erin, it's very difficult when we have different personalities when we work on a rescue mission, and the egos are very, very different in terms of what we do as rescue practitioners, because we see us at the top end of what we do in pre-hospital emergency medical care. So when we have to manage those relationships, is to smoothen out the relationship, is to pre-plan and get the right guys, to see what you are coming to do in their kitchen. What are you coming to cook in their kitchen? What are you bringing to the table in terms of rescue, your structure that you are bringing, your equipment, the personnel that you are bringing, so that you can gel as a unit, because the disaster is all about integration. It's an integration rescue, because and very much you have to trust the individual that you are going with. It's like going into a war, and somebody has to have your backing. So those individuals need to have my backing when I go into their kitchen and started to cook, and then we need to manage those relationships, and it's very difficult as we are coming from different parts of the world and going to various other provinces. So we have to, pre-plan preparedness is very critical in disaster. So what we do is we pre-plan and we get the right people to the right table, and we actually execute. What are we going to execute here? What is the plan? Where do they need us? Because then we smoothen out that relationship so that we can work together as a team, because there's nothing more disturbing than when there's distrust in a rescue team, and that is what you want on a rescue mission, because anything can fail on that matter, and you need somebody to have your backing when it happens.
Certainly, unity of purpose is an important one. Thank you, Marcus, for your time. Talking about teams, of course, someone like Marcus Butler is involved in search and rescue, and then the medical teams step into gear once those individuals have been, off he goes, back to the conference, once those individuals have been found, whether it's in a local disaster or an international one. Dr. Anupa Ramnarayan gave an incredible address to the couple of hundred people in the conference center. And Klantla, amazingly, this venue has been given to this conference free of charge as a gesture of goodwill, because of the kind of work that the likes of the doctor we're going to speak to now do. You've spoken so much about your different missions with Gift of the Givers. What keeps you going back?
I think the concept of giving back to a greater good, making a difference. Often people think going on these missions you benefit other people, and in a way it's true, but it comes down to what you believe your purpose is in life, what your concept of happiness is. And I think giving back and helping people who don't know your name, don't know who you are, and have no way of giving back to you, to me that's my greatest sense of purpose and happiness. Because we often so quick to complain about anything, complain about the country, complain about the world, complain about famine or war. But at the end of the day, if every person makes a concerted effort to make a difference, that's what changes the world, it changes the way of thinking. And if you want to move forward in life, your purpose is to take everybody forward with you. And, the sense of teamwork, the things you see, how you benefit and how you grow as a human being is not something we can describe unless you're actually there and you go on it. It really is something.
A very powerful message, and those are the kinds of anecdotes that we're hearing throughout this afternoon. The quality of medical training in South Africa, the purpose of those on these missions going all around the world, and some of the really hard skills that are required, the resilience needed to really go and be with people in disaster-stricken areas. And Flantla, with that, it's back to you in studio.
Our reporter Erin Bates out in the Western Cape, where Gift of the Givers as well as other stakeholders are sharing notes on disaster and risk management.